All children should be using their asthma pump with a spacer. If a child can inhale through their mouth and take the whole of the medication dose in with a single breath, they can use the same technique as an adult using a spacer. Some children, however, cannot take the medication in with a single breath. They will need to breathe slowly in and out of a spacer for multiple breaths. This is known as tidal breathing. For this to be effective, the spacer needs to have a valve so that when the child breathes out, the medication doesn't get pushed out of the spacer. Let's see how to use a spacer for children using the tidal breathing technique. First, assemble your spacer if required. Firmly push the two halves of the spacer together and rotate. To ensure proper assembling of the two halves, slide the lock mechanisms together. Make sure the mouthpiece cap of the spacer is firmly in place. Remove the cap from the inhaler. Shake the inhaler well. Step 1. Insert the mouthpiece of the inhaler firmly into the spacer. Place the mouthpiece of the spacer into the child's mouth. Make sure the child has closed their lips firmly around the mouthpiece to create a good seal, but is not biting it. Step 2. Holding the inhaler, press down on the canister to release a dose into the spacer. Hold the spacer in place for 60 seconds while the child breathes in and out slowly and deeply through their mouth. Step 3. Remove the spacer from the child's mouth and replace the cap on the inhaler. If a second dose is required, wait for a minute and repeat steps 1 to 3. When using an inhaler, rinse your mouth with water after using your inhaler, as this will prevent you from developing an oral fungal infection. Let's see steps 1 to 3 one more time. Remember to bring your pump with to every single visit so you can demonstrate it again and again to fine-tune any problems.